My name's Kathy Chambers. I'm a patient at Peak Injury Solutions. I probably started having migraines when I was about 14. I don't really know what exactly triggered it, but that's when I started having migraines. I don't really know what exactly triggered it, but that's when I started having migraines.
Wow. What was the hardest part during that time?
Usually just I would have terrible sensitivity to light and really, really terrible stabbing pain, like in my eye, mostly in my right temple or in my right eye. So I couldn't do anything. I would just stay in bed and be in the dark because I couldn't stand light. I couldn't eat. I couldn't move around because the more I would move around, the worse the pain was. And then you get a lot of nausea with it too. I think mostly I was just afraid of when those would come on, how long it was going to last. Because sometimes it might last a day, or I might be down for 2 or 3 or 4 days, depending on how bad it was and how quickly I caught it before I was able to sort of just go lay down in a dark room with an ice pack and take medicine, which was pretty much all I could do at that point.
What did you try before Peak Injury Solutions?
For that, I mean, mostly it was just different doctors prescribing medications, but it could have, I didn't really, I didn't have any sort of physical therapy or anything like that. They just tell you to avoid certain foods, that might trigger, like don't have a lot of caffeine, don't eat chocolate a lot, just different things like that. Avoid stress. That sort of thing, but mostly it was just a lot of different prescriptions.
Okay.
That didn't work.
That didn't work, yeah. Hear about Peak Injury Solutions?
I actually heard about it through a friend that had been treated, and she was, a while ago, it's been about 10 years ago that I met her. She was a physical therapist, and I guess she ended up looking for someone to treat her, and she went to him for a totally different issue, but I ended up coming in for a different problem than headaches. And when Dr. Magiot was treating that problem, I just happened to mention that I got migraines and that I wasn't feeling well. And I almost didn't make my appointment because I was not feeling well. And he said he could help me with the migraines.
Your first experience like with Peak Injury Solutions?
Well, as far as getting treated for my migraines, it was actually a little bit scary because I had never knew that was an option to treat migraines, and when he told me he could help me, it actually scared me a little bit because when someone starts, sort of messing with your neck, it was just totally different than anything I'd ever had done. Because when he started to treat it, I could feel the path of my migraines, like go around. Yeah, it went from the base of my head around and then into my eye, and it was like a question mark, but it was this tingly weird, and it really freaked me out, but it worked.
That's awesome. For you, the scary part was, is this actually going to work? Like, did you not want to get your hopes up that it would actually, like, is that what it was?
Yes. For this treatment, I just thought, I'm tired of taking all these different pills that don't really work, or if they do work, say it takes a long time. It's not like an immediate thing, as opposed to just preventing them from happening. I didn't think there was going to be anything that would actually prevent them from happening. So for him to tell me that he could treat me, I thought, okay.
You've already accepted the fact that
that's the way it's going to be.
That's what it's going to be. So when someone says, no, we can help you with this.
Yes.
It's like, wait, I'm not ready for that yet. Like, I'm not ready for the
I'm not ready to believe it. Yes. Right. Yeah, I wasn't ready to believe it. It took me a little while, but then I started to realize I haven't had them. I can't remember exactly how many visits I had before I noticed it had been 6 months since I had a migraine, 7 months since I kept realizing it was getting longer and longer and longer. And that had never happened to where I went that long without even a single migraine. If I'm under extreme stress, I might get the beginning of a migraine, but I can just take something over the counter and I'll be fine in about 30 minutes. And it was never like that before.
So it's like it's going to take a lot.
It takes a lot for me to have a migraine, and they're not nearly as severe, and I don't lose, I'm not losing even an hour or 2 hours really. So it's a huge difference. Migraines, it's completely different. Yeah. Completely different. I may have, I think in the past year, 2 migraines. So that's huge. That's like 2 migraines a month before, where I would lose days, and now it's 2 in a year, and they're nothing. Wow. And when I say migraine, they're nothing like they used to be. It's just I can kind of tell it's coming on, and I take some over-the-counter, just Excedrin or something, and it's gone in 30 minutes, and I'm fine. I go about my day, where before I couldn't do anything for 2-3 days sometimes, because I would be so sick that it would kind of last, I would still feel terrible days after, but it's just, it's nothing like it used to be. Nothing.
No longer interrupting your life.
And it's not my life. That used to be my life. Wow. Like, okay, this weekend or these 3 days, I can't do anything. And that's just the way that it was. And I don't have anything like that now.